Welcome to another episode of the Science Guide ASAP Learning, where we simplify complex medical topics. Today we're going to discuss a complex and significant psychiatric condition known as bipolar disorder, a mental health condition characterized by extreme mood swings that include emotional highs, mania or hypomania, and lows, depression, as well as cyclothymic disorder, a milder form of bipolar disorder. The DSM-5 categorizes bipolar disorder into two main types, bipolar I and bipolar II. Bipolar I disorder is diagnosed when a person has at least one manic episode, which may be preceded or followed by hypomanic or major depressive episodes. Manic episodes are characterized by an abnormally and persistently elevated, expansive, or irritable mood and increased goal-directed activity or energy, lasting at least 1 week and present most of the day, nearly every day. Symptoms of a manic episode according to the DSM-5 include inflated self-esteem or grandiosity, decreased need for sleep, excessive talkativeness, flight of ideas or subjective experience that thoughts are racing, distractibility, an increase in goal-directed activity, and excessive involvement in activities with a high potential for painful consequences. Bipolar II disorder, on the other hand, is characterized by one or more major depressive episodes and at least one hypomanic episode, but with no full manic episodes. Now let's talk about cyclothymic disorder. Cyclothymia is a milder form of bipolar disorder, characterized by at least 2 years of many periods of hypomanic symptoms and periods of depressive symptoms that do not meet full criteria for a depressive episode. While these mood swings aren't as severe as those seen in full-blown bipolar disorder, they can still impair day-to-day functioning and cause distress. Diagnosis of these disorders should always involve a thorough clinical assessment to rule out other potential causes of the patient's symptoms, such as medical conditions or substance use. The treatment of bipolar and cyclothymic disorders often involves a combination of medication and psychotherapy. Mood stabilizers such as lithium or anticonvulsants are often the first line of treatment for bipolar disorder. Atypical antipsychotics and sometimes antidepressants may also be used, but care must be taken due to the risk of triggering a manic episode. Psychotherapy is also essential in managing these disorders. Cognitive behavioral therapy, family-focused therapy, and psychoeducation can provide support, education, and guidance to patients and their families. Now, let's consider a typical pattern of bipolar disorder. Take, for example, a 25-year-old woman named Lisa. She has periods where she feels extremely energetic, overly talkative, and highly confident. During these phases, she sleeps very little and spends excessively, leading to financial troubles. Then, without warning, she plunges into episodes of deep depression, finding it hard to get out of bed or engage in daily activities. She even experiences recurrent thoughts of death. These drastic shifts in mood and behavior suggest a pattern typical of bipolar disorder. Finally, let's touch upon mood episodes with mixed features. This term applies to both manic and depressive episodes and refers to the presence of several symptoms of the opposite mood polarity. Mixed episodes are particularly challenging to manage and often require a comprehensive treatment approach. In summary, bipolar disorder and cyclothymic disorder are multifaceted psychiatric conditions that require astute clinical acumen for diagnosis and a comprehensive, individualized approach for treatment. As future clinicians, understanding these disorders is essential in the landscape of mental health. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one.